Hi.
Hey, hello everyone. So we are here with our Cannabis Live with Heather and Amanda. We just want to welcome you all. We're very excited to be here for our second installment of our live stream series. And we're just really excited to be here. So my name is Heather, and tonight we're going to be discussing the Endocannabinoid System. And we'll also be touching on a few points of Clinical Endocannabinoid Deficiency as well, so CED. And we're so excited to get started and fill you in on all of this amazing information. But first, I want to welcome Amanda, our wonderful and knowledgeable educator here at Hempfield Botanicals and Hempfield Apothecary. So welcome, Amanda.
Hi, Heather. Thank you. I'm excited.
Thank
Second
you.
one.
Yeah, that's for sure. So before we get started, we're going to just really briefly introduce ourselves again. Just in case we have some new people watching, we want to make sure that everyone knows who we are and a little bit about our background. So, and then I'll start off, and then Amanda, I'll just have you chime in then and just kind of introduce yourself briefly. So as everyone knows, my name is Heather Kreider, and I'm the co-founder and co-owner of Hempfield Botanicals and Hempfield Apothecary. I am a registered nurse here in the state of Pennsylvania. My background included orthopedic trauma, traumatic brain injuries, TBIs, stroke, spinal cord injuries, and of course, definitely caring for patients that are dealing with chronic pain. I'm a licensed esthetician, published writer, and how Amanda and I actually met is that we were a panelist on numerous cannabis educational panels in Miami and also Long Beach. So that's really how I met Amanda. So yeah, so Amanda, I'm going to let you take over and just give a brief who you are.
Who I is. My name is Amanda, and Amanda Hughes. I'm in Texas. And I am a licensed esthetician, and I teach cosmetic chemistry. I am also a cannabis educator. I am an evolving herbalist and a jewelry designer. Mm-hmm. So how did I become a cannabis educator, or why, I guess would be more important. Firstly, is I was a patient, a cannabis patient. And I had a lot of health issues, all sort of centered around thyroid. But then, hey, why was my thyroid bothering me? And I hope to get back into that later. But I found cannabis, and I consider myself healed because of that. And I had to dive in and learn all I could possibly learn about the plant and how it worked in your body. And then I was motivated as I'm an educator at heart. So I was motivated to share that knowledge and information and to continue to learn and gain and grow and achieve more of that knowledge. I have done lots of podcasts and videos and education materials, and I've written articles all related to cannabis and some related to cannabis and skincare. So my two worlds collide sometimes. And I am really excited to be doing this after meeting Heather a year and a half ago, I guess.
Oh, yeah.
We kept talking about doing something together. So it kind of, a pandemic sort of pushed us into something we probably never thought of before. So I'm glad to be here.
Yeah.
Also, I do want to add Happy Veterans Day to the veterans.
Yeah.
I am being in Texas. It's true what they say about cannabis prohibitionists in Texas are alive and well. And so we have a big fight. Yeah. And I have to acknowledge the Texas veterans. I have my Texas veteran shirt on, not just for their service, of course, but for being the most inspiring activists in Texas that I have come across. I mean, they fight so hard, and it's really just an honor to be able to fight next to them for this plant. So
that's fantastic.
That.
Yeah. Thanks. And Amanda, you know, myself too, as far as being a cannabis activist myself, I'm a cannabis patient, medical marijuana patient here in Pennsylvania as well. And I too know, just like you do, the benefits of this plant, and it's amazing. And I'm so excited to dive in. So let's get moving and really, get to kind of what we're all here for, which is the endocannabinoid Cannabinoid System. So first of all, I would like to let everyone know, if you have questions, please feel free to put them in the comment section. And we would love to answer any of your questions at the end. So Amanda and I are going to go through and do some education. And then at the very end, I'll read some of your questions off if there are any in there. So just feel free to comment. We'll see all those come through. And first of all, before we get started as well, give me a thumbs up if any of you on the live stream has ever heard of the endocannabinoid system. So I'll just give a little bit. I'd like to see some little thumbs going up, no thumbs going up. The majority of people, and Amanda, you'll agree to this too, is people don't know what this is. I'm a registered.
They think I made it up. They think we make it up.
Yep. I'm a registered nurse. And I will tell you, when I went through training through college, not one time was I taught about the endocannabinoid system in my body, and that there can be a deficiency. So to me, that is just like prohibition of the biggest, sort, because our bodies, we need it. So that's one thing. And even medical professionals, physicians will tell you too, they don't teach it in medical school. So it's definitely something that needs to be more light shed on. So, and that's what we're here for today. So we're just going to get started here. Amanda, tell us what the endocannabinoid system is.
So the endocannabinoid system, and I forgot to put the dogs out, and I forgot to give them CBD.
It's okay.
Usually I give them their CBD, and then there's no problem. But I forgot.
Yeah, right.
So anyway, I want to answer what is the endocannabinoid system, but I want to also kind of tag on to medical professionals. I have had conversations with several medical professionals, but two of my own personal doctors, and told them what the endocannabinoid system and what it is, and both of them were pretty outraged that they weren't taught that in medical school. And they were both of them are under 40, so you'd think they would have. But okay, so what is it?
Yeah.
So the endocannabinoid system is another system in your body. So you have your circulatory system, your respiratory system, etc. You also have an endocannabinoid system. We didn't know that until late 80s, early 90s, thanks to Professor Raphael Mechoulam. But we didn't know that we had it. We sort of discovered that we had it after we realized cannabis was helping and affecting us in different ways. Once we knew that it was affecting us in different ways, then we had to learn why. And it's the endocannabinoid system. So this system is a system that sort of links all your other systems together. So it helps to regulate your body and bring your body into homeostasis. So homeostasis just means balance. And if you're having a system that is overregulating or underregulating or overproducing certain enzymes or hormones, or underproducing, it can help to regulate your body so that system can acclimate and also be in balance. So the endocannabinoid system just links all of your other systems together. And how does it work? So we all know and have heard of hormones, and we all have heard of amino acids and things that we have in our body that play different roles in our health. But what we have also is something called endogenous, meaning internal, endogenous cannabinoids. So we have endocannabinoids that our body makes to regulate the endocannabinoid system, and thus regulate other systems in your health and of your body. But those endocannabinoids are things like anandamide, which is sort of your bliss molecule when you feel really happy, like the birth of a child, or even like a runner's high, things like that. You have 2-AG. There's so many of them, but what they're doing is they're providing you with balance. Endogenous cannabinoids are even passed on in breast milk from mothers to their babies. So when you are in perfect health, and the world is in perfect health, your endogenous cannabinoid system can rock this. Your endogenous cannabinoid system can do it all. But who's in perfect health all the time? and how is the world, or when can we get the world in perfect health as well. So we have environmental factors and pollutions and stressors, and then we have our own illnesses and the things we put into our body. There's so many factors that put our health into imbalance that we are not in perfect homeostasis with the endogenous cannabinoids that we have. So we can supplement with exo, meaning external, or exocannabinoids. I also will call them phytocannabinoids, so they're from plants. So we use phytocannabinoids primarily found in cannabis. The word cannabis actually came before the words cannabinoids and endocannabinoids. So we have this whole system in our body that was named after these compounds. So the endocannabinoid system, whether it is your naturally occurring endogenous cannabinoids or whether it is exocannabinoids from the plant, it can help you to regulate these systems by activating certain receptors or modulating certain enzymes that affect the receptors. And the reason that is important is because these receptors are what's responsible for sending out other messages to the parts of the body or to the systems or to wherever it's actually needed. This is the information in a very small, tiny nutshell that we have now. And I feel like that is only scratching the surface.
Right.
Like once we really have access to the plant, which we need for the research, but we can't do the research unless we have access to the plant. Once we have more information on all the cannabinoids and more receptors than we even have discovered thus far, and how those receptors and enzymes sort of modulate the rest of the body, then we will, we'll know more beyond where we've just sort of scratched the surface. But we do know that. So that's essentially what the endocannabinoid system is.
Yeah, and it's infuriating to me as a medical professional. To this system is it's this same type of a system as the circulatory, the respiratory, your digestive, so it's part of our multiple systems of our body. And I'm really excited to learn more and more about it as more research goes on. So
Right.
it's exciting, definitely exciting to see.
So I always think about things when we learn new things about plants, because I'm an herbalist also, and when we learn new things about plants now, we're learning them because of like microscopes, right? We're not really learning as much about the plant and its effects and how to use it. That information's been around a long time. But what we're doing now is because of technology and microscope era, now we see that there's a system and there's receptors and there are these enzymes and these modulators that are happening that we couldn't see before microscopes. So I think it will just evolve further into more knowledge for sure.
Exactly. So I know you touched on a little bit, but how does the endocannabinoid system affect other systems within the body? So you said a lot about modulation and things like that. So if you want to just dive in a little bit deeper on that.
I will, and I'm going to touch on that, but then I'm going to give an example, and then I want to encourage everyone else to sort of think about their own health or their own experiences they've had with their health in the past, and how you can really start to imagine how the endocannabinoid system has affected you. So that endocannabinoid system that you have produces these endogenous cannabinoids, or we introduce the exogenous, the phytoplant cannabinoids to the body. So these act similarly. The effects of both of them are similar in the way that they affect these receptors. So in this Blue Man chart, you can see some of the receptors. This is absolutely not all of the receptors, but this is some of the receptors and some of their effects on the body. But the two receptors we have the most information on are CB1 and CB2. The CB1 or cannabinoid receptor 1, the CB1 receptor is primarily found in the brain and in the central nervous system. So it affects a lot of things, brain activity and a lot of pain. It is not the only place that those receptors are found. It is just primarily the place. CB2 receptors are primarily found in the peripheral nervous system, and then in the gut, and your immunity and immunity and gut to be go hand in hand. That's primarily where the CB2s are. That is not only where they are. They are also abundant in your skin. CB1 is abundant in your dermis, CB2 in your epidermis. So the skin, you know that your skin is similar to lots of other tissues in your body. So they're everywhere. It's easy to see how this endocannabinoid system would affect everything else if it's that interconnected. And I discovered the difference between the specific difference between CB1 and CB2 years ago when I was treating my own health with CBD, and I was having some results. I was treating some thyroid issues that I was not taking pharmaceuticals for, and I was having some results. But then when I introduced THC, I really had phenomenally better results, and my numbers and lab work proved that. And the reason is because there's a CB1 receptor, and there's CB1 receptors in your thyroid, not just CB2. And so I just like now that, you know, once you sort of see that picture, which was really they couldn't possibly list all the locations of the receptors, or even all the receptors, because there is more than just those two. You can really start to see, well, like me, like, yes, I had a thyroid issue, and the thyroid issue was causing these symptoms. So it wasn't that the symptoms were the problem. It was the thyroid that was the problem. That's the diagnosis I had. But really, it wasn't the thyroid that was the problem. It was the endocannabinoid system imbalance and the lack of homeostasis that was the problem. Because once I forgot the thyroid, I didn't take thyroid meds, and I started the treatment for my endocannabinoid system, then I really began to heal. So enough about me, but it's a good example.
Yeah, most definitely. Yeah, that's fantastic. So can you tell us a little bit about, so I know we've briefly touched on this throughout, but so when there's an imbalance in endocannabinoids, you know, what happens when there's this imbalance? What kind of conditions does endocannabinoid deficiency trigger?
Yes.
I can give you my prime example of that as well, which is migraines, chronic pain,
me too.
migraines.
Yeah, migraine is my biggest, and I still have some migraines, but not like I used to. Mine are now they're mostly hormonally driven and pandemic driven. But so what can happen? So what cannot happen? So if your endogenous cannabinoid system is helping to balance your circulatory system, then if you balance that endocannabinoid system, you could regulate things like blood pressure. If it's helping to balance other endocrine issues that you may be having, it could affect things like thyroid or blood sugar. If your endocannabinoid system is helping to balance, circulation would also be a regulation of temperature, heat. I found that was a big one for me. I was always cold. My hands were always cold, and I'm in Texas, like it's almost never cold. So the list would just be endless because that endocannabinoid system is so closely related. There's a lot of gut issues that are helped with cannabis because there are so many receptors in your gut area and your digestive system. So IBS and Crohn's, and the list goes on and on and on. And of course, everyone's familiar with the use of primarily CBD, but also sometimes THC, depending on the diagnosis, for seizures, for seizure disorder. I mean, there is FDA approved pharmaceutical drugs that treat seizure disorders with cannabis.
Yeah.
So, and then of course, if it's treating seizures, that's where it can also come in and balance your system, then treat migraines or Parkinson's or ALS or on and on and on.
Yeah.
So you asked me about endocannabinoid deficiency.
Yeah, deficiency.
Endocannabinoid deficiency is just exactly what it sounds like. So just like if you had a vitamin D deficiency, you would have symptoms from
Yeah.
that. If you had a vitamin C deficiency, there's scurvy, right? There's all kinds of deficiencies. So endocannabinoid would be the endogenous, the internal, your natural cannabinoids. If you are deficient in those, meaning your body is not producing, not that it's not producing the right amount, but it's not producing enough for your current
Right.
state. So, in other words, when your current state is stress or hormones or lack of sleep, then you're getting migraines. So you may up your cannabinoid intake. So you were endocannabinoid deficient in that moment. So the endocannabinoid deficiency sort of indicates that the tone that your body is comfortable at, your endocannabinoid tone, and mine's different than yours.
Yeah.
Yours is different than mine, just like some people can drink red wine, some people can't. Some people can consume dairy, some people can't. Some people can do 7 hours of sleep, some people can't. So my tone for what's good for my body is different than yours. And the endocannabinoid tone, if it's not regulated, and if your tone is low, meaning less than desirable, then that's where you have that endocannabinoid deficiency, and then that's where it's not regulating and creating homeostasis, and you can have multiple illnesses or conditions. And I think that each of us have sort of a personal medical physiological disposition for certain illnesses.
100%.
I'm prone to migraine. I'm prone to migraines and thyroid issue. My mom had them, right? But I could eat dairy all day long and I don't feel bad about it. I don't feel sick from it. Obviously, too much of anything, and I would. But whereas someone else would not be well. So if an endocannabinoid deficiency shows up in my body as a thyroid issue, an endocannabinoid deficiency can show up in someone else's body as Crohn's disease.
Right. Yeah, I agree with that. We all have, none of us are perfect, and there's always something in our body that's, I always say, like, not wired correctly, or, so, when you're deficient in that, those types of things then surface and come to the surface. So, yeah. You had mentioned something earlier, and I just want to throw this out. So, when we looked at the Blue Man, the slide that I had up earlier. So the CB2 receptors are in the brain and the brain stem. So I thought it would be interesting to touch on just really quickly too with that and how it works within the body. People always, one of the biggest questions that we get asked all the time is, can I overdose on cannabinoids? So I thought it was interesting actually seeing that visual. We have opioid receptors, just like we have cannabinoid receptors. So you want to touch on that just a bit?
Yeah. So if by overdose you mean die, no, you cannot die from an overdose of cannabinoids. The systems in your body that are controlled by receptors that also control things like swallowing and breathing and heart rate, and then you have to do all those things to be alive, but you never have to tell your body to breathe or swallow or tell your heart to beat. So there's not in endocannabinoid receptors that directly control those things. So there are opioid receptors that control those things. So no, you won't die. Can you take too much and think you're going to die?
Yes.
Yeah. You can.
Yes.
You can. And although the story might be funny later, it wasn't funny when it was happening.
100%.
So yes, you can, because that's where it comes back to your endocannabinoid tone. So people like to use the word, I don't like this word, but people like to use the word tolerance when they talk about, oh, my cannabis tolerance, or my THC is commonly the one they're referring to, tolerance. And so it's like alcohol. Everyone has a little bit different tolerance, but I don't think that that's a tolerance thing as much as it is a tone thing. So how much cannabis, and when I say cannabis, I mean one of hundreds of cannabinoids. How much of that cannabinoid or multiple cannabinoids do I need to maintain a nice tone for myself without feeling like I've had too much and oh God, I'm gonna overdose. So I have had, I mean, THC would be the most common thing that people feel like they've had too much of. But I know for me, if I have a really good quality CBD product and I consume too much of it, it'll backfire.
Mm-hmm.
It'll backfire on me if I've done it too much. And I did this, quite frankly, when COVID hit and my spa shut down, and we all thought we had to, bleach our groceries and,
Yeah.
that whole thing. I was taking a lot more CBD. And I noticed after a couple of days that I was just feeling kind of achy and kind of headachy. And of course, I thought, oh my God, I have COVID. And as soon as I just didn't take any I woke up and realized, oh, maybe I'm taking too much. I woke up and realized that, and I didn't take any until before I went to bed. I took a small dose and I was fine.
Yeah.
So I've heard that before. I don't have scientific evidence that that's what was happening, but because CBD does not give you an intoxicated feeling or a euphoric feeling, it's THC does, but CBD does not. But because CBD doesn't give you that, it's a little bit difficult to know when you've had too much, like it is with THC. Um, so finding the sweet spot is where we have to just find the sweet spot, and not only find the sweet spot, but find the combination of cannabinoids and terpenes that give us that sweet spot, and then be prepared to change your sweet spot.
Yeah, 100%. You have to listen to your body. Your body knows what it needs.
Right.
And, being able to listen to it and pick up on those cues. We all know our bodies. As soon as there's something not quite right, it's like, oh, there's a little scratch in my throat, or, you almost can tell like something's brewing. So, it's very true. Our bodies know what we need for sure. That was fantastic. Thank you. Great information. So let me just check the questions here really quick, and then we can wrap up. Leah says, hey, I love this plant. Let's see here. So Leah said they don't teach it in schools about endocannabinoid system. Very true. She asked the question, will Texas ever let us have this plant? I'm not waiting. I sure hope so, for Texas's sake. You need it. That's
So
for
Leah,
sure.
I don't know if you're in Texas, but make sure you follow my Texas page, which is linked, Higher Education Texas. I think that this session we will see some changes. I really feel confident in that. So we got to do the work.
Yeah.
Just like
So we have a question here from Rachel Lawrence. How do we even begin to try the right combination for yourself and the sweet spot? This is a good, one of the things that I've found with myself personally is being a medical marijuana patient myself. Sometimes people go in and they're like, ooh, like, THC, THC, THC. It's all about THC levels and things like that. You have so many other cannabinoids to look into and research and find what works for you and what your needs are, but your terpenes. And I cannot wait until we start diving into some of those. Amanda, those are your favorite? Honestly, they're my favorite as well. They're amazing. And a lot of the strains for me, myself personally, I choose based on the terpene levels. And that it's amazing.
So that was a really good question. And I think also to answer that would be, well, what do you have access to? Because the entire country has access to hemp derived CBD. And if you are not in a place that you're going to get drug tested, then you'll try that full spectrum so that you have another cannabinoid in there, and probably a few more minor ones, because the way it's extracted, you have more of the whole plant compounds. So wherever you are, you determine, well, what do I have access to? If you're in a state where there's a medical program, look into that. Then you'll have more access if you qualify, because they're certainly going to have products that are should be mostly different than just hemp-derived CBD. So how do you know? You don't know until you start. But one thing you do is consult people that have done it, that know, that have recommended over and over and over, have consulted. Anyone, I have always been an educator that says anyone that knows more than you do about anything is an educator.
Mm-hmm.
So find someone who has done this before and start. Just start.
Yeah.
And start with the things that have heard have helped other people with similar conditions, and start low and slow, and keep a journal, and select quality products, obviously. But as to Heather's point about the terpenes, which I can't wait to talk terpenes, is that next week, the next time?
Next week are cannabinoids, and then
Okay,
we'll
so terpenes are after that.
Yeah.
The terpenes are going to be in December. Oh, that's perfect. The second week in December is my birthday, and I get to talk about terpenes.
Yay!
So it's not just the cannabinoids doing the job for you, it's the terpenes. So that's something to pay attention to too when you're trying to treat. It's unfortunate that we are treating our health with this plant that really, if we would have never stopped the legitimate legal research, then we would know the answer to all this. We would know that, well, typically when you have pain, I want you to try a 1-to-1 ratio of CBD and THC with a little bit of CBG, and I want you to look for the linalool terpenes. Like, we would know.
Yeah.
And though everything I just said could be true for some people, but it's not in a book to tell you this is the recommended dose. It's only suggestions because we are so far behind on where we should be with this plant.
Yeah, it's a shame. It really is. But we're making progress, and that's a good thing. So that's exciting.
Yeah.
So,
well, this is why we're doing this.
Yes, exactly. I think that was our last question. We have Tommy on here. He says, yo, yo. Hi, Tommy.
Yo, yo.
All right. So thank you so much, Amanda. I really, really appreciate you sharing your amazing knowledge with us. We're going to wrap up now. One thing I did love that you mentioned is you had mentioned with, I believe it was Rachel's comment or question, reaching out to people who know. So, right here in front of everyone, we have yourself and myself, two knowledgeable individuals that are very well versed in this field. Come back and see us again. Listen, tune in. We're going to keep teaching everyone. This is our passion. Amanda and I both love this so much. So we're really excited to do this for everybody.
And if I don't know the answer, I'm going to find you someone who knows the answer.
100%, because we don't know it all, for sure. 100%. So, all right. Well, we're going to wrap it up for now. Don't forget to come back every other Wednesday at 7 p.m. For more live cannabis education. Our next live stream, due to the upcoming holiday, so it would have been on Wednesday, the evening before Thanksgiving. So what we can do is Wednesday, December 2nd at 7, we'll discuss cannabinoids. So the different various types of cannabinoids. We'll talk about the main ones. There's many, many, many of them, but we'll just go over the main ones, what they do, who they are, what they do, and how they affect our bodies. So we really hope that we see you back here in 3 weeks. Normally it's 2 weeks. Come back in 3 weeks. Also make sure that you follow our page. If we have any Pennsylvania medical marijuana patients, you're welcome to join our Medical Marijuana Connection group on Facebook as well. And also make sure to set your notifications to alert you when we go live. So thank you so much for joining us, everyone. We really look forward to seeing you again and helping you on your cannabis journey. Thanks, everyone. Have a great evening.